Hi, I'm Aruna Nayak. I'm the Managing Director of Getinge Medical India. Patient care in India is right now in a very exciting phase, and personally it is very satisfying to see the amount of accessibility that is increasing in the country. I think thanks to the government and the private insurance schemes, we are seeing many more people being able to afford extremely high care therapies which are really moving towards global standards. And moving into the future, this is a trend that's expected to continue, that Indians will have much more access to really cutting edge technology, cutting edge medical technology, which will make life expectancy, quality of life significantly better. What is also very satisfying to note is that there is a lot of integration of technology, be it artificial intelligence or other forms of digitization, which will move, which will increase the convenience of patient care in India. Given the the importance of ventilators in India, we are working towards Make in India ventilators, and we are also looking at localizing some of our existing portfolio of ventilators in India. This is one project that the India Innovation Center is very actively involved in, and we really hope that in the short to medium term we are able to launch a Made in India ventilator, which was designed and innovated and manufactured in India. So that's something that all of us at Getinge are really proud and working towards. India is a top 10 market for Getinge as in terms of sales, and has been identified as a focus market globally. If we look at our ambition, Getinge globally wants to double the number of lives saved by 2030. Given that context, our participation in India becomes very important, because this is where a large portion of humanity resides. So India is an extremely important market for Getinge. In India, we operate with our complete global portfolio across the three areas that we operate in, which is acute care therapies, surgical workplaces and life sciences. In acute care therapies, our focus is to improve our presence in the ventilators portfolio, anesthesia machines, also in the hemodynamic monitoring space, where we see a lot of interest in the Indian market. We are also very excited about the growth that we see in the cardiovascular space. Given the high risk that CVD has in India, it is a very important portfolio of life-saving technology that we offer to the Indian patients. In surgical workplaces, this is an area where we see a lot of growth, because a lot of capital expansion is happening in India when it comes to healthcare infrastructure. So our portfolio across surgical workplaces, which is around operating tables, lights, pendants, is in a very good growth phase right now. And another area where we are particularly very active is the infection control space, be it equipments or consumables. This is an area of strength for us, because this is where Getinge started. That's part of our DNA, it's part of our history, and we are true pioneers when it comes to infection control, and so we are very strong in this portfolio as well. The third part within the surgical workplaces, which is a big area of focus for us, is the digital health solutions, and this ties in very nicely with the theme of Digital India, where we want to introduce products like Tegris, TDoc, which will really improve efficiencies in the hospital. Now moving on, I think the other piece of our strategic vision for India is to put service first. We have a very big install base in India, and we consider it as a responsibility to ensure that these equipments are well maintained and serviced in time. We have one of the largest team of service engineers, about 130 in India, who ensure that we have a very good uptime when it comes to our equipment. So in India, we have a dominant market share when it comes to ventilators, particularly in the high acuity segments, and that is something that we've been very consistent about in our 20-year history in India. Globally as well, if we look at Getinge, ventilators in India are, we are one of the top markets when it comes to ventilator sales. So, it's no surprise that Servo-C was launched first in India. When we look at Servo-C, it's truly a new generation ventilator for lower pediatrics and adults, with a range of tools for lung function monitoring. It can be used for invasive, non-invasive and high flow therapies, and it offers really seamless transition. What is also very interesting is it really offers personalized ventilation with several tools like servo compass, etc. So it is truly a new generation ventilator which we are very proud to offer to Indian patients. We are at the cusp of launching several products in India like the Corin OT table, which is a new generation premium operating table with intuitive user management, patient recognition and a very unique color coding mechanism. We are also launching the Easier OT Lite, which is specifically targeted towards the the short surgeries in the segment with variable color temperature features. We are also launching Poladus 150, which is a unique low temperature sterilizer with hydrogen peroxide for heat sensitive surgical equipment, and this will really ensure this has a real zone separation and will minimize the contamination risk for a hospital, which is really crucial these days. And the most exciting launch of all is the Servo C ventilator. What makes this the most exciting is that late last year we launched this product globally, and the first sale, the first installation was done in India, and this is something that all of us are really very excited and proud about. Through our global CSR and sustainability funds, we work with Pratham in India. This is a long partnership that we've had with Pratham for the last 5 years. We do a lot of work in supporting education in the eastern part of the country, and this is something that is really motivating for all of us because it gives us a validation of our work by giving back to the society. I think if we look at India alone, we've done a lot of pioneering work when it comes to educational initiatives. As we launch cutting edge technology in India, it becomes very important for us to help work with healthcare providers to bring in education so that the technology is well accepted, understood and implemented. So we work a lot in these areas through our clinical and application specialists. But a concept that's very unique to my heart and we are working on is also to launch a national skilling program for nurses in the area of neonatal ventilation. We hope to bring down through our efforts at least make a small change in the neonatal infant mortality in India through our initiatives. So Swedish companies in general tend to have a very open and free flowing culture, and it really helps foster innovation. At Getinge also that is a focus for us. We want to ensure that everybody is entitled to bring in their best at work, and that's something that we truly focus on. We have a lot of diversity and inclusion measures to ensure that everybody is invited to the party and everybody is invited to the dance floor as well. There are some very unique policies that we offer to our employees in India. We also offer paternity benefits to our employees who've become fathers as they enter a very different phase in their life. Overall, the policies are designed to be very employee friendly, and we are very proud to say that we offer some of the best employee benefits to our people in the country. And I think as a result of all of this, we've been we've had the Great Place to Work certification in 2023, and that just shows our commitment and our passion towards our people.